Session 9, let us look at disorders of the esophagus. Session overview looks at diseases that affect the esophagus, such as gastroesophageal reflux disease, which is GERD, and the esophageal varices. So the session takes students through the description, clinical manifestation, as well as the management of these conditions. So at the end of the session, students should be able to define gastroesophageal reflux disease and then esophageal varices, and then describe the disease associated with the esophagus, and then link the pathophysiology of gastroesophageal reflux disease to interventions used in the treatment and management, and then be able to recognize signs and symptoms, complications, and diagnosis of these disease conditions. So the key topic to be covered in the session is gastroesophageal reflux disease, GERD. So gastroesophageal reflux disease, GERD, as we all know, the esophagus provides passage for food from the oropharynx to the stomach, and approximately about 5 centimeters above the esophageal entry to the stomach is narrowed area called the gastroesophageal junction, which is GEJ, or lower esophageal sphincter. So lower esophageal sphincter remains constricted but relaxes when peristaltic wave is conducted through it, allowing food to pass through to the stomach. And so on the screen we have some pictures, and let us look at these pictures and see what will happen. And so what I'm referring to, if you look at the sessions here, we have the section of the esophagus, we have the lower esophageal sphincter, which is here, and then we have the down here too. So there is closed, this closed lower esophageal sphincter, and this one is open. And so when food enters the esophagus and goes into the stomach, then it's closed, so the food does not come back. But here it's open, and so stomach contents pass through the LES, causing heartburn. And so when this happens, it means that acid reflux and then other food substances may come back into the esophagus and cause what do you call, some kind of pain over there because of the acid component. So the LES, which is the lower esophageal sphincter, is a high pressure zone that acts to prevent an acid reflux into the esophagus. So contraction of the LES seems to be mediated and coordinated by the 10th cranial nerve. And so when we are looking at gastroesophageal reflux disease, it refers to the reflux of stomach and then duodenal contents into the esophagus. And because the LES fails to close between swallows, and this functional disturbances permits excessive regurgitation through the LES. So in other words, what we are trying to say is that because probably the pressure over there is reduced as a result of any possible factor, then the possibility of the abdominal content, including acid reflux into the the esophagus, is high, or possibility of the acid content coming to that place is high due to the lowered pressure effort over there. And that's exactly what we are looking at. So etiology, GERD results because of the alteration in the usual protective mechanism, and this include esophageal peristalsis may fail to clear the lower esophagus of the reflux disease content, and then esophagitis has been found on many occasions on endoscopy in more than 50% of individuals with symptomatic GER, and there may be delayed gastric emptying due to reduced peristalsis. So there may be increased volume production of gastric secretions, as we can also see in Zollinger-Ellison's syndrome. So the LES is composed of circular muscles, at least at the distal end of the esophagus. That is different from the rest of the esophagus, both physically and then histologically. So disorders of these arrangements may also lead to pathologic degrees of gastroesophageal reflux and then related complications, and this may also lead to inappropriate and then very low pressures, allowing backflow of the gastric or the stomach content into the esophagus. Other causes, lifting a heavy weight is also likely, because lifting a heavy weight is possible of increasing abdominal pressure, and so stomach content can also come up, and then crushing the chest due to an injury is also a possibility. So GER also known to follow surgical procedures involving the abdomen, for instance gastrectomy. We have drugs which can also increase the reflux, has also been observed in patients who are on anticholinergic drugs, as some of these drugs reduce the pressure at the lower esophageal sphincter, and so these drugs are likely to permit the gastro abdominal contents also to come to the esophagus. And so an increased LE, incompetent LES may be aggravated by sudden increase in intra-abdominal pressure, such as what occurs after ingestion of heavy meals, and then the bending over, lifting, and then wearing tight clothing. So GERD may also result from prolonged or repeated vomiting from various conditions, or prolonged nasogastric intubation, as we can see in patients who are admitted and they are not able to eat and we pass NG2 for a very long time. So we have clinical manifestations. We have the heartburn, which is pyrosis. We have regurgitation. We have dysphagia, difficulty in swallowing, and then other simple manifestations. Complications, we have esophagitis is likely to occur. We have peptic esophageal stricture, and then we have also esophageal ulcer, which may also occur. And so let us look at diagnosis. And diagnosis point at careful history of the patient. And then we can also do barium swallow and then endoscopy examinations. And then this will show if there is presence of strictures, neoplasm, and reflux of the gastric content into the esophagus. And then we can also do continuous ambulatory 24-hour esophageal pH monitoring, which is used to confirm the diagnosis because of the acidity. And then this diagnostic measure will show the amount of acid reflux into the esophagus, under which specific circumstances this occur, and the correlation with symptomatology. And then either by sensor placed 5 centimeters above the upper border of the LES. And then single sensor can be used, and then dual sensor can also be used. Medical treatment, the goal of treatment for this condition, GERD, considers to administer antacids which neutralize esophageal contents, and then to promote gastric emptying and acid clearance. And these are the drugs. We have beta-nacol, we have metoclopramide, and then which increases LE pressure, promote increased gastric emptying and acid clearance, and then relieve symptoms of reflux. And then we have anticholinergic drugs, for instance, the aceclomide, and then hydrochloride, and then propantheline, bromide, are contraindicated in patients with LEED. These drugs delay stomach emptying, and then decrease lower esophageal sphincter pressure, and then decrease the frequency of this. And so when these drugs are given to patients, it will rather complicate the situation. So these drugs are contraindicated. And then surgical conditions. I know you are going to do surgery studies on this, so I refer for you to read. So surgical management, read on this. And then I've provided some simple pictures over here, which you can add to your surgery notes. What kind of surgeries are done? For instance, Nissen Fundoplication. I've provided you notes on that. But your lecturer in Nurs 234, I hope so, will able to look at that. So just go through these notes. And the nursing management, dietary management is very important for this patient, because we are looking at gastric acid. Standard reflux diet restrict spices, pepper, foods with high fat content, which will increase gastric volume. And then postural therapy. The patient should not lie down immediately after eating, and no food should be eaten for approximately 2 hours before bedtime. And this is likely to enhance gastric reflux into the esophagus, and it should be avoided. So behavioral modification is very important. Exercises and diet are encouraged to decrease obesity and maintain weight within the normal range, and it may be important to avoid alcohol consumption, as this may contribute to acidity. And then the drug therapy and medication, antacids, are selected on basis of their effects on bowel regulation. And then Gaviscon is used to relieve heartburn, and it neutralizes acid at the surface of the stomach mucosa. And then contraindicated medications in jail, for instance, probantin and others, should be avoided. And then refer to other drugs already mentioned in this slide. As part of your reading assignments, I want you to look at esophageal varices, and then to build on the ideas that you have. I think this is the end of this session. Shall we prepare for the next session? The references are there. Thank you very much.